If you're a yoga instructor, this list unfortunately is really familiar to you. Inner knee pain in postures like lotus and pigeon, SI pain and twist, forward bends and transitions, pain in the front of the hip in deep flexion postures like happy baby pose, and of course pain in the front of the shoulders in chaturanga and postures where the arms go overhead. These injuries are typically produced from repetitive stress, often from imbalanced sequencing, and from practices that emphasize flexibility much more than they produce stability. To help teachers understand these mechanisms of injury and to ensure that we're teaching in the most up-to-date, safe, and scientifically informed way, I've brought different doctors of sports medicine into my programs over the years. Most notably, Dr. Brian Lau. Brian is the doctor of sports medicine for Hong Kong's Olympic athletes, and he's strongly influenced my injury management curriculum. Bringing the light of modern sports science into my trainings has not only been incredibly revolutionary for the way that I teach and for my students, but it's also really helped me evolve my own personal practice and teaching style. Some of the injury prevention techniques that we're currently focused on in my trainings include teaching students to create greater eccentric strength throughout their entire body, helping students balance their ratios of passive range and active range of motion, slowing transitional movements in Vinyasa Yoga so that students are using strength and control instead of just momentum. And another thing that we've been doing is diversifying the types of vinyasas that we're doing so that we're less likely to create many of the repetitive stress injuries that are common in other approaches to Vinyasa Yoga. In addition to these injury prevention techniques, Dr. Brian has helped shape my approach to working with existing injuries in class. Of course, there are limits to how much yoga teachers can work with injuries in their public class. It's imperative that we respect our appropriate scope of practice as teachers. That said, in my advanced trainings and injury management programs, we look at reducing the symptoms and addressing the underlying cause of many different common injuries. To name just a few, we address knee issues like meniscus and ligament injuries. We learn to help students manage and navigate common hip joint challenges like hamstring attachment strain, anterior hip impingements, and SI joint dysfunction. And as Vinyasa teachers, it's essential that we also know how to help students work with shoulder challenges like rotator cuff impairments and bursitis. Yoga is, without a doubt, one of the best things that we can do for our body and mind. And my goal is to help ensure that when you practice yoga and when you teach yoga, you're doing so with the techniques that are going to be most sustainable and healthy over time.
I learned so much from him, especially on anatomy and how to do a pose more safely. If you want to have a sustainable practice for your student, I think this is a course for you because you can learn how to take care of yourself and you can learn how to teach in a safe way, which will decrease injuries for your students.